So
Why
as
don't
I
you
was
start off?
saying, Jay, I'm originally from New York, and in New York, you have like these four major hospital systems. You have Columbia, Cornell, NYU, Mount Sinai, and every one from each system, there's a lot of cross-pollination. You'll hear that, oh, NYU professor is giving grand rounds at Columbia, and Cornell professor is going to be giving a talk at Mount Sinai. And there's so much cross-pollination that these four systems have really made New York's healthcare the best really in the world. That's where people
Nice.
from all over the world go. Sloan Kettering, that's where you go for cancer treatment. I mean, it's amazing. So much talent in such a small area. When I moved to Arizona, I was shocked at how that's not the culture here. I went to Mayo for my fellowship. You will never hear a banner physician giving grand rounds at Mayo. You will never hear a dignity physician referring a patient to Honor Health. It doesn't happen here. And it's so bad that it doesn't happen because you know what? There's different specialties in that different hospital systems are really good at. But every hospital system wants to say, no, we're the best at everything.
Right.
And it really leads to poor patient care. Now, in the PI world, what I learned was that a lot of chiropractors, for good reason, are a little bit suspicious of pain doctors. That we get a pain doctor on board just to maybe ask some questions. They're going to steal the patient, run up the bill, really squeeze
Mhm.
us out. And I hear pain physicians that are trivializing the role chiropractic care plays. And I often ask them, I say, have you ever actually observed a chiropractor? I can tell you in my fellowship, there was no courses in chiropractic medicine. There was no rotation in chiropractic medicine. Just recently, the ACGME has started putting some questions related to chiropractic medicine on the pain medicine board. But that came from outside criticism that you pain doctors are operating in a silo, and that's why you don't know anything but opioids for your patients. And there's a lot out there. So all of a sudden, Eastern medicine became a topic, chiropractic medicine became a topic, physical medicine became a topic. But that was in reaction to a criticism leveled at us. So I don't
Yeah.
think that when people are fearful or suspicious of pain doctors, that that's completely undeserved. What I can say is that I spent 40 years of my life in a city where everything was about collaboration. And I've seen it work. I've seen it work for the patients, I've seen it work for the doctors. Doctors are more knowledgeable because they learn from each other. And that's who I am. I feel very much out of place in Arizona when I see all of this happening. So I want to bridge that. That's why I've taken such a active role in really learning, trying to learn more about chiropractic medicine, trying to understand it, referring patients for it, believing solidly in it. One of the things that really intrigues me is that chiropractors are beginning to now, I think in the last few years, take the lead with trauma, headache trauma, which I think is great because that's an area where even pain doctors don't want to go. It's an area where I go, and I
Okay.
love that there's chiropractors that are looking to delve into that uncharted territory, and I want to collaborate with them. For me, they're doctors. They're doctors. They're part of my club. They're part of
Yeah.
my club, and anyone that wants to learn and collaborate, that you're in my specialty because that is a subspecialty in itself.
Yeah. Dr. Gupta, that's a great way of looking at it. And it's really neat to hear that that's how New York has worked with that collaborative effort because I don't know what it is. It's the Wild West. And we come out the further west we go, where
Yeah.
we get in those silos and we get into that. I hate to use the word fear, but we're so scarcity mindset of we're going to lose a patient if we refer them out rather than what's best for the patient. How do I build a club, like you're saying, a group of good, like-minded doctors and attorneys that are actually ethical and communicate with each other and really have the patient's best interest at heart, both health and healing, as well as financially for their restitution from the injuries they sustained in the injury. So I love your attitude with how you're handling this, and I just wish we had more of that out west.
Well, one thing I can tell you that really impressed me about chiropractors was that I went to an ultrasound training course in Colorado, and there was this doctor who invented his own ultrasound machine, and he all he was trying to do was teach people how to use the ultrasound to do stem cells. And he says, I can't find allopathic physicians that actually want to be trained in this, but I find so many chiropractors that want to be trained in it. And I said to myself, I said, these guys want to learn new things. They want to come out of their comfort zone and try different things. And That's something we all should be doing. And I love the fact that chiropractors are constantly reinventing themselves and trying to push the envelope in what they can do for the patient. And I think that there's a lot that I can learn from them. There's a lot that I can learn from their attitude and their approach to medicine because in many ways it's all natural. We in the allopathic world are all about, well, what did Pfizer come out with? What did, Merck come out with? You guys are actually talking about looking at the patient, touching the patient, and seeing how we can naturally help the patient, which is really how medicine was meant to be practiced.
It's a beautiful observation, and that's great. And it's great that you have that teamwork effort. Chiropractic is a very unique part of the healthcare system since it's so naturopathic oriented, but it works so well with the medicine and the co-care if they just team up. But I love your attitude in that you're recognizing there's lanes and staying in our lanes is where we're more successful and communicating with each other. Yeah, really good perspective. Thanks for bringing that out west with you. That's fantastic.
I think,
Pardon?
Jay, that there's a lot of us out here that want that, but we're waiting for someone else to say it's okay to be that way, you know?
Yeah.
So I think that we can do this here. We just need that initial, like they say in life, the hardest thing is to go from 0 to 1. So once you do that, this kind of a attitude is contagious. People love
Yes.
it. People love it. People at Banner want to know what the Mayo physician thinks. People in pain medicine want to know what the chiropractor thinks. We just need to get past these artificial barriers that have been created.
For sure, for sure. And I think that's where you need a group, something like the Whiplash Group that's getting into the area and pulling doctors together of different specialties, having seminars together where they're co-training to with each other. One of our great members here in Utah, Dr. Smith, he's a chiropractic physician, but he's also a advanced neurology training and concussion specialist. But his clinic is actually on hospital grounds, and so he's in the monthly meetings with all the other doctors where they are training each other. And it's a completely different animal at that hospital than in the other hospitals in the valley where
Yeah.
they actually, like you're saying, the pain doctors and the chiropractors and the emergency room doctors are all communicating and training together, which makes a different group, a
hmm
different a different thinking pot, so to speak.
And the
Well, how
interesting
many?
thing is, in a place like Manhattan, to go from Cornell to NYU is a 45-minute brutal commute. And
Mm,
people do it as if like, okay, today I'm gonna have to get up early. I have to go all the way there. Here in Arizona, to go from Banner to Honor is a nice sunny drive. Like it's not like you have all these weather issues and congestion issues and roadwork issues. I mean, you can't make that argument. I mean, in Arizona, physically going across the street to a chiropractor's office and saying, "Look, my afternoon patient canceled. Do you mind if I just hang out and just see what you're doing?" It's very easy. It's
yeah.
very easy. And we are the Wild West, but we could use it in a good way or a bad way. We could say we're the Wild West, so it's totally okay to go into another doctor's office and just observe them. Whereas in a place like New York, you have to fill out all these forms and really there's so much red tape over everything.
Wow.
So so that works in our favor that we can do that, but we just have to be willing to listen to each other and learn from each other.
That's awesome. Well, I know you're doing that actively because you're going to seminars because that's where I met you. But are you doing any lunch and learns where you're meeting up with the doctors, the chiropractors?
I
What are
am.
you doing to?
Yeah, I am. I'm always looking for an opportunity to meet with chiropractors to do something like a lunch and learn. But I think that part of it is that, when I approach them and I say, I want to come to your office, oftentimes, I guess from their standpoint, it's, well, we already know what you do.
Yeah.
So I want to kind of break that barrier because I'm also doing things that others don't do. Like I
Hmm.
put a lot of emphasis. I don't do nerve, I mean, I do nerve burns, but for the personal injury patient, which tends to be a younger population, I try to do more stem cells and platelet-rich plasma. And I use
Nice.
X-ray guided, not ultrasound guided, but X-ray guided imaging to actually get it into the right area. And I've had phenomenal results.
Oh, that's
Most of my
brilliant.
patients never need to come back. Whereas in the old way of doing things of nerve burns, these patients are now put in the vortex of nonstop pain. And I've
Gotcha.
always told my pain colleagues, I said, why don't we switch our business model? Instead of
Yeah.
saying, if I got a patient, I need them coming back. Why don't we say, if I got a patient, I need them to be well and get out of my clinic so that
Hmm.
they're a walking billboard to anybody else they meet in their journeys that might have pain.
Yep.
Wouldn't that be much more impactful? That one walking billboard that did well at your clinic that never needs you again will meet hundreds of people in a given month. That's
Hmm.
much more business for you than finding a way to bring them back with steroids and nerve burns, which again, they're just temporary band-aids. I mean, I can do them, and
Right.
for my Medicare patients, I do, but for the personal injury patients, I've had phenomenal results with PRP, stem cells, and the insurance companies don't push back. The auto
That's
policies do
fantastic.
not push back. So I
That's
think that
fantastic. That's how it
I
should be.
would I would love to have chiropractors learn a little bit about how I'm doing that, how I'm using it for actually for whiplash. Because as you know, whiplash is originate in the junction of your neck and your head. Well, those facet joints can be repaired if we get to them soon. We can't get wait 6 months to a year. We
Yeah.
need to get some PRP right there, right away.
Mm.
And we need to get vitamins. We need to do vitamin infusions. So again, it's very much natural therapy. My own wife was in a car accident and she had a concussion. And the neurologist said, you need vitamin B2 twice a day, you need magnesium once a day. And because I did vitamin infusions, I said, honey, we're going to get you these at Walgreens, but I'm giving you infusions on the side. And I gave her infusions. It hasn't gone away completely, Jay. When she gets really tired, she still gets some headaches. But I think that she's a million times better than she would have been had she just gotten gabapentin
Right.
or triptan. So I feel like I'm onto something here. We're here in the valley. We can do it. We need to get these patients in. We need to get
Yeah,
these
for
TBI
sure.
patients in. We need to get them going. And that would happen side by side with chiropractic care, not in
Yeah.
place of, but side by side.
That's beautiful. That's the way to do it. It's a team effort, collaborative effort for patients and PI for sure. So, do you have multiple locations in Phoenix?
Yeah, I have one location in Mesa, right near Sossaman Road and Broadway, so really far out. So that we get patients all the way from Apache Junction. I have a location in Phoenix, which is kind of like our Phoenix slash Scottsdale location. It's right on the border, right near Mayo. And then we have a Peoria location, which is on Thunderbird. So we've really covered the three locations, the three areas of the valley. And it's
Yeah.
always right off of the highway. So we think that that is a very important thing for patients because then they can just get on the highway and get off. And we provide transportation for our patients.
Wow, that's so nice. That's great. So it sounds like you got things dialed in pretty well to be helping in the personal injury world. You have a great, healthy relationship with the local chiropractors to help collaborate with them together. Or do you have a few attorneys that you really like working with in the area that you've found are pretty ethical?
Yeah, I mean, I think Larry is definitely probably the most ethical one that I've found. He's a top-notch guy, very caring. Just his own story. Anytime I talk to him, he talks about his children. He talks
Mhm.
about the challenges that he faces as a father, and then he just shakes it off and says, "I'm going to go play the guitar." And I
Yeah.
love that. I love the outlook that he has that's full of life, full of energy, because I think that he brings to his work. And he's the kind of guy that, like my dad, may he rest in peace, used to always say that always look at a man's desk and it'll tell you a lot about who he is. And I almost imagine one day I want to visit Larry's office and see his desk. I bet you there's a picture of his children there because he looks
Yeah.
at them every time he does a case and he thinks of the patient as his own family member. And so I
Yeah.
like those kinds of people. He's one of them. Another one that I really like is this guy, Jackson Ross. He works part of the Shapiro group. He's phenomenal, young, charismatic, energetic individual, always puts patients first. I have Brendan Gallagher. He also has been phenomenal to work with. I will be honest with you, I haven't, maybe they don't like me, but I haven't found too many PI attorneys in Arizona that are unethical. Okay, I'm sure that they exist, but their lanes haven't merged with mine. So I can go on and on about how many different PI attorneys I like to work with. Um, and with the attorneys too, I think that a lot of it is education because just like you have those big firms that are burn and churn, you have the big pain groups that are burn and churn, where the doctors don't talk to the patients. There's no customization of patient care. There's trivialization of what other providers are doing. There's like a
Right. Right.
grab bag over the limits. So I think that my sermon on ethics has to begin with me. I have to go out and I have to say, this is who I am and this is what I believe in. I don't go after the patient if I didn't get what I wanted. I don't fight with the family over reductions. I don't um, kick the dog if by any chance the case doesn't go anywhere and there were no limits.
Yeah.
It is what it is. We're in this space because we want to do good patient care. And as long as the patient did well, we got our reward. Everything else is secondary.
Great. Well, fantastic. Well, hey, just before we wrap up, is there anything that you want other doctors or attorneys to know about you? Just a random thing about you that most people don't know.
So I love hiking. I love hiking so much that my wife always says, "Oh, the kids they always want to learn from you, but they never can." So I started this thing where I take my kids hiking with me and I ask them, "Is there something in school that you need help with, or is there something in life you want to know about?" And they t give me a topic, and while we're hiking, we talk. And I
Great.
found that I am able to communicate better and they're able to learn better. So I think that, you know, I don't want any more meetings that are at a table. I say let's walk and talk. I love walking and talking. And sometimes device company people will come to me and they'll say, Dr. Gupta, we want to take you out to dinner and this and that. I said, how's this? Sunday morning, I go for hikes. If you really want my attention, let's go hiking. Most of them never show up because they're out Saturday night partying. But it's a great way to get exercise. It's a great way to build relationships with people, and it's a great way to celebrate where we live.
That's fantastic. Fantastic. Dr. Gupta, I want to thank you for being with me on the call today. And I hope to share this with several in multiple states to see what a great example you are in the personal injury world of just having good ethics, good personal skills, and communicating with other doctors, and just having a team approach for our patients and our clients. So thanks
Thank
for
you
being
so
here.
much, Jay. And I know that you're well entrenched in this world. Whatever we can do to support you, we always will. And if you know of any chiropractors in Arizona that you think would be interested in collaborating with my model, then please make an intro, and we would love to meet with them.
Will do. All right.
Okay.
Thank you.